Good evening, ladies and gentlemen, and welcome to the meeting of the North Lake County Hospital District. Nice to see all of you. Hope to hear from all of you. If you will, please stand, bow your heads for a moment of silence. Let us pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Ms. Kirsty will do a roll call.
Mrs. Aliberti? Mr. Douglas?
Here.
Mr. Hansing? Mr. Harper?
Here.
Mr. Hurley?
Here.
Ms. Price?
Present.
We do have a quorum.
We do have a quorum. Okay. We will now address the minutes of our last meeting, which was held on January the 22nd. You have those in your packet. I will entertain a motion.
I'll make a motion to accept the minutes as presented.
Okay. Is there a second?
Second.
Okay.
Aye.
Any discussion? Any questions? All right. We'll call for a vote.
Don't have to do a roll.
All in favor, say aye.
Aye.
All opposed, the same. Okay. In your, I think earlier in the week, you received an email, and it just kind of a summary of our January 22nd meeting where we approved the Crippen plan to streamline the hospital and clinic quarterly reimbursement process. Are you familiar with that? Everybody got it? Is there any discussion or any questions that we have about that tonight?
You know, were the hospitals on board with, do you know if the hospitals were on board with the guidelines of the dates that we kind of assessed?
Yes, sir. I haven't officially listed out the dates as a requirement yet. I was waiting for discussion, informal approval of the board of the plan, but everybody seemed on board and willing to participate with the timelines.
Okay.
All right. Chair's going to call for the quarterly report. Mr. Matt, you want to do that?
Sure. Matt White, I'm with the Crippen & Company, which is a CPA firm, not to be confused with Forbes and Mazars, who's the CPA firm that issues the quarterly report. So included in the packet under number 5 is their quarterly report for the quarter ended September 30th, 2025, which is the most recent available quarter end that issued in final form. Included in there is the procedures agreed upon by both the trustees and Forbes Mazars, their report thereon with the approved submissions by dollar amount. And they were all within budgetary constraints and confines. And they have 95 percentile confidence rating on their testing. So those numbers are believed to be accurate and reimbursable. Any questions about the packet?
There was one line in there that I saw. It said, he said, had we performed additional procedures, other findings of significance may have been reported to you. I just don't like the wording of that, and I wonder, should we implement additional procedures? Is there something that is lacking that we're not asking for?
I don't believe so. Obviously, to the will of the trustees are those procedures. It is an agreement of procedures between the trustees and Forbes Mazars as to direction as to what they are to do. So those are always at your will. You can change them, add to them, remove from them as you see fit. Certainly, I think what you're highlighting is just language to state, to cover them, to state that they didn't do. They only did what we asked them to do, and had they done other things, that if we had asked them to do other things, it may have come up with other information that may have been reportable to the board. There have not been a change in the procedures other than enhancing the work around undocumented or ensuring people are truly constituents in the North Lake County Hospital District. I know that was a concern a couple of years ago. So there's been no change to the procedures. I don't believe there's any weaknesses in them. I think that's just the coverall statement to state that we only did A, B, and C, and had we done D, E, F, it might have been different.
I was just hoping they'd be here tonight so they could, if they had any suggestions, make them to us, you know.
Certainly.
Okay, motion? Motion on the quarterly report,
Bear with, just give us a minute.
okay.
Does the board mind if I add a little context to that report? I think something that you know, but I want to remind you, within the report is LifeStream's Behavioral Health Center, which has a $1.2 million budget for the 25-26 year. I believe listed in there was an approval of up to $480,000 for this quarter from their submissions. Part of what their budget line item is the funding of the low-income pool LIP payment that goes to the ACA at the state level. Not being totally accurate here, but $1 up to the state provides $2 down to the community. So we just got the LIP invoice. It was approved in the LIP contract was approved by the board in January at $1,068,863 for LifeStream for this budget year, and we got the invoice yesterday and have processed it for payment. It is in agreement with what the contract was, $1,068,863. So that eats up a big chunk of the $1.2 million, but not all of it. So of the 480 that's listed there, they'll be able to go up without any further budgetary remediation or amendment. They'll be able to go up to 1.2. So we will fund ACA on their behalf, the intergovernmental payment of $1,068,863 per the contract, and then the balance between that and $1.2 million will be funded to LifeStream Behavioral Health. So just a point of clarity, I think you guys knew that and understood how the LIP payment worked, but LifeStream doesn't get a direct $1.2 million from this district. We pay a low-income pool intergovernmental payment on their behalf to give them a better value.
Okay.
So that's what that, the 1.68, 863,000 was, that's what that was a reference to, the bill that just came across?
The LIP payment, yes, sir. Yep. We obviously encourage all of the providers, hospitals, and clinics to submit to the full extent of what they were able to see and do. In the event that they go over budget, they're only funded up the budget, but it gives the trustees an opportunity to review that and consider reallocations if necessary. So they've submitted well beyond already, and they will likely continue to submit each quarter.
Is there a motion?
Make a motion to accept the proposal as it was presented.
Okay, do I hear a second?
Second.
Any discussion, questions? All right. You do a roll call. All in favor, say aye.
Aye.
All opposed? Okay, hearing none, we'll accept them. All right, there's not anything for us to discuss much about the budget because we don't have enough data until July, so we actually won't be voting on anything tonight, but we will hear the presentation of our mid-year update and projected expectations from our hospitals and clinics. So at this time, we'll call on UF Health, Leesburg Hospital.
Good evening. My name's Kent Bailey. I'm the Senior Vice President, System Controller for UF Health. So I'm here representing UF Health Leesburg. You're probably used to seeing Heather Long, Phil Braun. Heather Long, President and CEO of Leesburg, Phil Braun, who's been with the organization as legal counsel for a long time. They really wanted to be here, but unfortunately they couldn't, so I'm Excited to be here. I've spent a lot of time with the Leesburg team in the last 2 years since I've joined UF Health. Back in the 90s, I was in public accounting. I audited Leesburg, and very familiar back then with the leadership team and the great mission of Leesburg Hospital. So excited to be here tonight. I have 3 slides, really simple. I'm going to give you an overview of the volume, what's been going on at UF Health Leesburg, kind of a picture of our payer mix, and also the last slide will be just a summary of, as you're most aware of and probably most interested in, is where we stand relative to our uncompensated care that we're submitting to you under your guidelines for your reimbursement. And happy to take any questions as we go along. Hopefully I'll do this right. So first, just our volume. You can see no changes really in the capacity. We're 330 beds. Our emergency department volume growing. Admissions are growing. Our surgery volume is really about flat. The decline really is some lesser acute type surgeries that we're moving kind of out of the hospital. So it's really not a decline in the sense of the more acute procedures we're doing. And you can see an open heart, cardiac cath, and imaging procedures, pretty solid growth year over year. Next, we'll look at our payer mix. UF Health Leesburg continues to see a lot of Medicaid, a lot of Medicare, and uncompensated care patients. So why that's important is it doesn't really give you the opportunity to cross-subsidize care when you have a broader insured base. So we continue to be challenged from that perspective in order to cross-subsidize uncompensated care. My last slide is just where we stand relative to our funding with the district. You can see I believe the budget for the board set for this year was $4.2 million. Right now, we're projecting to submit claims of about $3.3 million. As you've probably heard in prior years and from other providers, working with patients to collect the information and have the documentation in order is a process. So we're working really, really hard to improve that process so that we're capturing, as many of those patients and those dollars to submit to you. We're implementing some things next year that we think will help us to more effectively gather that information and submit it to you and your team for reimbursement. So our ask for next year is at the $4 million level. We have another bar on here, which is the orange bar there, really is what we believe is our true cost of uncompensated care. As unfortunately, as I mentioned, because of some of those barriers in gathering all that documentation, we're not able to fully achieve that. But we thought it was important to kind of point that out. So with that, I'm happy to take any questions or, yes, sir.
So I see you got an increase in open heart surgeries. Are these projected? You were kind of not halfway through the year. Is that projection something that was formalized recently on the open heart surgeries?
Well, that's a combination of, if I'm understanding your question
Yeah,
right.
because you have an increase of 30%.
Right.
So
So it says projected, that's really, so our fiscal year is June 30. So that's an actual plus a projection either probably for the last 3 months. So that's the actual, 3/4 of it's the actual results.
yeah, and is that due to the aging population or just our community overall? I mean,
I think it's probably as much in our ability to deliver that care, having the right.
you got the quality of the tools, the professionals there.
Yes, sir. I don't know that it's specifically the community's experiencing more heart conditions.
Yeah.
I think, yeah.
And the reason I'm kind of leading into that, because that's a very high, it's a very expensive process and a long recovery process. How much of that is generally would fall on, you may not know this off the top of your head, how many of those would fall into the Medicaid, Medicare window
I would think it would be proportional to
in the same draft here probably?
I don't think it would be dramatically different.
Okay, so they're a very large expense carried in the Medicaid, Medicare.
It would be.
Yes, okay.
Yes, sir.
That makes sense. All right, thank you.
Reminder to the board, would you please turn on your microphone for recording purposes? Thank you.
I'm just talking too far away.
Okay, let's come closer then.
Yes.
I'm getting the sign.
Thank you, Kent. That's all I had.
Okay.
Thank you, Mr. Bailey.
Thank you, and appreciate all your service to the community.
All right, now,
Advent Health wants to speak to both of them at the same time, both the hospital and the clinic.
okay, Advent Health, hospital and clinic, I hear.
Well, good evening. My name is Brandon Nudd, and I'm blessed to serve as the president and CEO at Advent Health Waterman. I'm relatively new to the role, started in October, but have been with the Advent Health family for about 25 years, serving in various capacities. And I'm delighted to be here to talk about Advent Health Waterman and what's happening in our hospital and the services that we provide the community. Starting out, I want to make sure that we're grounded in who we are from a mission and vision perspective, how we show up as we connect with our team members and the patients we're blessed to serve. Really want to be grounded on our mission to extend the healing ministry of Christ and be the provider that really shows up and delivers the amazing services that we can. Highlighting this past year, we have a number of different initiatives that have taken place, and this is a snapshot of who we are from a numbers perspective. 310 beds. We had close to 800 births, quite a few primary care clinic visits. We had ED visits for 66,000, and you'll see that over 2,000 team members. What I'm most proud about is the close to $100 million in community benefit. And when we talk about community benefit, we'll go through a slide in a second that kind of articulates where those dollars are spent. Ultimately, we want to be great community partners, and this is just a snapshot of a few of the partners that we have in Lake County. Many of them we donate, we volunteer, we're on board positions, we collaborate as we're taking care of the folks that live in Lake County. Our community benefit, as I look at the different categories, you'll see the specific in charity care, the $17 million. That is really what we're here to talk about today, and a number of different initiatives that we have rolling up to that's offset with the work that we're doing as a nonprofit. Specifically for the hospital, you'll see that so far in this past year, we're projected to be in a deficit. And so we believe the number is going to come in around $3.6 million with the funding of around $3 million. We're projecting this coming year for the number to be close to $3.4 million. Specifically with our clinic, we have had to have a little bit of disruption, and that's really unfortunate. We've had some utility issues, we've had some provider gaps, and as a result of that, we have not been able to have as much access as we've had in the past. Still trying to make sure we lean into this part of our ministry, and we are at a slight surplus on that, so we want to update you on that progress. Definitely trying to make sure that we continue to lean into those services to care for the community. Ultimately, as I conclude, I wanted to highlight that these dollars are important. We are really blessed to be able to continue to provide obstetric services. We're trending nicely as we continue to grow in that area this year. Part of that is really difficult, recruiting OBGYNs, adding laborist model to the expense structure for that service. We also, this past year, added 2 primary care locations, and we're in the process of adding 3 more this calendar year. And so we believe fundamentally that as a nonprofit hospital that's grounded in our faith tradition, we need to show up in a way to provide more access and take care of the community in a meaningful way. A lot of the work that we do from a procedural volume space, it's important, but what the community needs most of all is access, and we're happy to be able to do that. And so much of the dollars that we get through these fundings allows us to lean into that space. I'm happy to answer any questions. This is obviously my first time in front of this group, so I'll do my best to answer them.
Is the clinic back online?
It is. We had disruption and we had to relocate to an off-site location, but we are back online.
Unrelated, but are you guys the one that are moving into the old Red Lobster?
That is correct. Yes, sir.
I've been hearing that, and I just didn't know. So that's what that's going to be, is a clinic?
It is a primary care clinic. We're relocating an established clinic and basically tripling the size to add more providers.
Another unrelated one. The relationship you have with Lake Sumter Community College, I'm on a nursing board too, but I understand that they're looking to build a new building for some of the nursing programs there. You may or may not be aware of that, but they're looking to expand. They have a very high demand for nursing client base at the Lake Sumter Community College. So they're looking to build a whole new building to support that opportunity. So you may hear something in the future on that.
I would love that. We have a great relationship with the college. We have learning labs in our medical office building. Love to create an environment where the students can thrive on campus. And I know with Advent Health trying to grow in neighboring counties and specifically here in Lake County with another hospital, it's important that we are intentional with workforce development. It benefits us all.
So I don't know if you're aware of it. I know Leesburg High does have a nursing program for their students. I think we graduated like 16. So, and they move, of course, will move into Lake Sumter. So I'm sure the other campuses do the same thing, but there's quite a bit going on at the school level.
At the high school level?
Yes.
Okay. I know this past year we had, one day we had about 400 to 500 students on site, just really trying to encourage healthcare careers, great learning labs, simulations. It was a fantastic day to really get folks excited about pursuing healthcare. That's definitely what we need.
It was definitely a high need.
Yes.
I have no further questions or comments.
No other questions? Thank you very much.
Thank you.
All right, we'll hear from Livestream.
Good evening. My name is Rick Hankey, and I'm President and CEO of Livestream Behavioral Center. And you would think with all my education, I would know how to do a PowerPoint presentation, but always seems to make it very challenging. So I am actually excited to come before you today to share with you some of the things that are going on with Livestream. The LIP dollars, those are the hospital taxing district, that's our match to get the LIP dollars. So we do appreciate that, and that's when sometimes I call in a panic. If we don't get the taxing district dollars, then we're not going to get our LIP dollars or our DPP dollars, and those are what helps our hospital to run. I say it every year, but I'll start off by saying we are a safety net provider. So most of the people that we provide services to are indigent. They come to us either underinsured or don't have insurance. So we do provide a lot of different services, but tonight I'll really concentrate on the hospital piece of our business. So just to, again, to refresh your memory, we are very fortunate and very proud of the fact that we have a comprehensive integrated health system. And that includes providing behavioral health, primary health care, and social services to over 41,000 people in the central Florida area. We have things like crisis intervention, inpatient, outpatient, our hospital services. We have residential treatment, primary care, educational, care management, psychiatric services. We work with the homeless. We work with rehabilitation for people who have behavioral health issues, as well as housing. So we are very fortunate to have a very comprehensive system of care. I want to just kind of highlight that again. With a comprehensive system of care in a state that is amongst the lowest in the nation for per capita spending on behavioral health, and then we're located in an area or a quartile, we're in the bottom quartile in the state for per capita spending for behavioral health. But we've been able to seam together a lot of different funding sources in order to create this system of care. Not a lot of organizations do have a comprehensive system of care. Our vision is to bring hope to life. The people that we serve deserve the quality of life, and a lot of times they come to us broken. A lot of times they come to us hopeless. And it's our role, our staff's role, is to let them know that there is a way that we can bring hope into their lives, that they can live a very productive life in recovery, whether it's substance abuse or mental health. And a lot of times they have given up all that hope. So it's really our role to bring them together. Again, creating hope, supporting recovery, and promoting health, that is our mission. That not only do we want to give them hope, but we also want to support whatever they call their recovery, as well as to promote their health. And that's why we brought integrated healthcare to our organizations. Not only working with the mind, but we're also working with the body. So a little bit about us, over 900 employees. We serve Lake, Sumter, Citrus, Hernando, Hillsborough, Marion, and Orange counties. Let me take that back. Hillsborough, we're not serving anymore. We're accredited by CARF, which is the Commission for the Accreditation and Rehabilitation Services. We're licensed at the local, the state, and also federal level. And we're very committed to our communities. As I said before, we are a safety net provider, so we go to where people are, where they need services. And I think I shared with you about 2 years ago when I came into this role that we changed our model up to where we are meeting people where they are. We have more team-based programs, people that are going into the community, meeting people in their homes, their schools, wherever they're more comfortable. We took our wait list to get psychiatric and other services from 4 to 8 weeks, and that was a good day, to same-day services. So we're very proud of the fact that we can get someone into services on the same day. Payer source, as you can see from here, self-pay is not exactly the largest part of our funding. We have about 1% of self-pay. We do have a lot of federal and state grant revenue. We get money from the Department of Children and Families through ACA, Medicaid, Medicare. That's really what we depend on in order to put together this system of care. What we have put into place in a lot of our programs is we actually have what is called a SOAR processor, and that individual works with indigent people who have no services, and we try to get them the entitlements that they deserve. It's a pretty complex system, especially for the people we serve, to understand how to get Medicaid, Medicare, or Social Security or whatever. So we have actual staff that are walking them through, sometimes holding their hands, sometimes taking them to the correct office and getting them the entitlements. The services that are provided to the North Lake Taxing District is our inpatient psychiatric beds. I'll show you in a minute all of our beds and the breakdown. We have 46 adult psychiatric hospital beds. Those are licensed by ACA. We have what we call our addiction receiving facility. That is a court-mandated detox facility. So we are able to keep people in an involuntary status in detox. Prior to getting that designation, if someone was in detox and said, I want to go home, we had no choice but to let them go home. Now we can keep them if we go to court and we get that court order. We also have 10-bed crisis stabilization unit and a 20-bed children. So really that is the basis of our hospital. And other beds that we have, the residential, I just really wanted to show you that we're just not the hospital. And a lot of times people think that, LifeStream, all they think about are our hospital beds and what they had to go through. And I think I told you this last year, and I'll just reinforce it. People do not like being brought to a psychiatric hospital. Most of the individuals are brought to us under the Baker Act. So that means they're Baker Acted. Law enforcement often brings them to us, transports in handcuffs. And so when they get to us, we then tell them we have to take away their shoes, their belt. We have to really suicide-proof them as much as we can. We tell them when they can eat, when they can sleep, and as a parting gift, we give them a lifelong diagnosis and psychotropic drugs. So we don't expect that many people are going to give us a 5-star rating. However, we know that we make a difference in people's lives. A lot of people come to us, they say, I don't need to be here, I don't need to be here, and it may not be that moment, but we do know that when they go through our continuum of care, we have seen people's lives change. We have people coming back and actually I've seen people in stores or restaurants or whatnot, and they come up and they just, give me a hug and cry, and I'm like, okay, there goes all that HIPAA thing, because you just screamed out that you were at LifeStream. So we work with that. But we have a geriatric residential unit. We also have adult mental health. We have substance abuse step-downs. We have an apartment building for people with low income as well as disabled residents. We have a 48-bed residential unit. We have people that are coming out of the state hospital, and we are actually giving them another chance at life, and we're giving them a skill set to either make them competent or able to get back into the community as quality citizens. And when we call our Road to Home has been one of our great successes. We have individuals, excuse me, that are coming from the state hospital. For most of their lives, they have been in and out of institutions. We're very proud to say that we have a step down where they can come to us. They stay with us for about 6 to 8 months, but we teach them the skill set, needed to not go back to state hospital. And we have been very, very successful with keeping people out of state hospital. A cost savings to the state, as well as helping individuals to get back onto their path of recovery. Here is just some information on the different types of admissions. When people come to us, you can see the large majority, 2,000, almost 3,000 people, come to us under the Baker Act. A certificate of professional, very similar to the Baker Act. These are all involuntary. So the only ones that aren't voluntary, or that are voluntary, are the ones at the end, a voluntary detox as well as voluntary mental health. We do have individuals that come to us and say, I need some help. So that's promising. These numbers have gone upwards in the last several years. Before it was all involuntary. Now we're seeing people coming to us from a voluntary, because we really have tried to get the message out to the community that we're more than just our hospital. We operate over 60 programs in our communities that are not the hospital, that you don't have to come in on an involuntary basis. Again, this is just an overview of the programs we operate in Lake County. Our Lake County dollars stay in Lake County. Even though we're in other counties, we don't mix and match the dollars, so Lake County is here in Lake County. And I know from the rigorous auditing process we have to go through, they can vouch that Lake County people are getting these services. So, I won't go through each and every one of them, but we do have a continuum of services so that when someone is discharged from the hospital, we just don't wash our hands and say, good luck to you, that we do have a aftercare, we do have other services that we get them involved in so that they can continue with their journey to recovery. Unfortunately, there are lots of challenges. The labor shortages, and I shared this with you last year. A child psychiatrist, the going rate is phenomenal. I mean, it's very, very costly. We are talking to child psychiatrists who want $500,000 upwards in salary. As I told you before, we're community mental health. We just don't have the money to spend that much. So we're really looking at how we can meet that need. The number of psychiatrists is shrinking. The number of nurses shrinking. So it's really kind of a challenge to keep some of our programs fully staffed. It's a very uncertain time, if we haven't already seen that. We see an increase in employment or unemployment. We see increased homelessness. No matter what's going on, there's still homeless individuals. Now, we've done a good job working with law enforcement to say that not every homeless person equates to someone who has a mental health issue. So we've been able to work with that piece of it. We have seen a lot of individuals that are experiencing substance misuse. We have still fentanyl on the streets. We have a lot of opiates that are still on the streets. And a lot of times individuals are able to cover that up with other, they come to us, they take a drug test, they come clean, but they're able to get other substances to hide whatever's in their system. So we've had to deal with that. And an increase in suicide attempts and suicide rates. Unfortunately, we do hear, especially amongst our adolescents, there is an increase in the number of attempts and suicides. So kind of wrapping this up here, we are a leader in high-quality integrated care. We have really focused on evidence-based practices to really increase our system of care. Recovery-focused and results-driven. We have measures that we actually, are we doing well? Are we not doing well? What's happening? What's working? What's not working? What population can we work better with, or what do we need to do to change our system? I've already explained some of these other things with you. The resources we get, we're very conscientious. I don't have millions and millions of dollars to just spend. So we have to make sure that we're very accountable and that we use every dollar in the best resource that's available to us. And when additional resources are available, we can do a lot more. We're very proud of the fact that we write federal grants, we write state grants, and we are very fortunate to get them. And that's the way that we develop our system of care. So that's all I have right now. It is mental health awareness. We have had a month of promoting mental health awareness. It's okay to get help. We've been promoting treatment. You may have heard things about LifeStream, but that's the yesterday. Today, come on in. We're here for you. So I'd like to say Happy Mental Health Awareness Month, but I don't have that's something that we celebrate. So it is mental health awareness, and we are making our community aware. So thank you very much. Any questions that you may have? No?
Do you have just the one campus, the main hospital campus here, or what's your locations here in Lake County?
We are located all over Lake County.
You have small, clinic offices?
Yeah, we have clinics. We're on 3rd Street in Leesburg. We have a clinic in Eustis. We have a clinic in South Lake. We have 2 primary care offices in Lake County. We're located in the schools. We don't own those offices, but we have, I believe it is 28 different sites in Lake County that we currently operate out of.
Yeah, looking at your people that come in through the ministry there, the LifeStream, look like you'll take in like 12 to 15 a day.
Through the hospital?
Well, yes.
Yeah. Yeah.
That's a very large number.
Sometimes we have a lot of people, and sometimes it's not as much.
Yeah.
But we've done studies. It seems as though Tuesday afternoons is when people want to get Baker acted, and it's like that's happy hour. But there are other days that not so much. But we do. It's a constant flow of individuals because we have to then assess them, evaluate them, get them into the hospital, get them admitted, and then it all starts from there.
I just have a quick question. What is the number of students coming in from the schools for mental health, suicide? Do you know that?
Well, there's two ways that I can answer that. We have close to 21 therapists in Lake County schools. But the number of children that are coming to us with mental health issues, substance misuse issues, in our hospital, we have 20 beds. And we keep those beds pretty much full all the time. So that just kind of gives you an idea. Average length of stay is about 2.75 days. So you kind of do the math there. You can see we serve a lot of children, a lot of adolescents. We're trying to get into the community to prevent, because the hospital is the deep end. That's the most costly. So what we're really trying to do is prevent that from ever happening. So we do have programs in the community. We do have therapists in the community that are really trying to keep them out. The one thing that we have added and have been very successful is that we have our mobile response team. We have our community action team, and those are teams that are actually going out to homes. For example, if a kid is acting out and the parents don't know what to do, they can call our MRT team. They will show up, and they will try to get them through the crisis, but not just get them through the crisis and leave them alone. They will continue follow-up services for as long as is needed. So we've changed the way that we're doing business to meet the needs of the community.
So my next question would be, school's going to be out. So do these students in the high schools or middle school, maybe even elementary school, possibly, do they know where to seek help? Have they been told in the different schools where to seek help?
From our therapy, the ones that we have in therapy, we know that mental health crisis isn't a September to May type of thing, so that we do it year round. So we have the services at our facility. So we have a children's center that they can come to. Now for new kids or whatnot, they come through. We have what is called our Wellness and Excellence Center, and that's where people will actually come in and get assessed. And that's where they get the same-day services, and so it's really close to our children's facility, so we can get them over there in no time at all. So we're very cognizant of that, because we really don't want a child going through it's bad enough when an adult goes through a Baker Act, but to see a child going through it is really heartbreaking. So we're really trying to prevent that from actually happening. All right. Thank you very much. I'll see you in a few minutes.
Thank you. All right, at this time, we will listen to our clinics, and we'll start with community health centers.
Hi, good evening. My name is Mark Dickinson. I'm the Vice President and Chief Financial Officer for Community Health Centers. I think, we've been here on many occasions. As I say, we're a federally qualified health center organization. We have 11 centers in Orange County and 5 centers in Lake County. 2 are in North Lake County, Tavares and Leesburg. Those centers provide medical, dental, optometry, behavioral health, and pharmacy services. We have, the last fiscal year, we did approximately 250,000 visits through all of our sites. And I was listening to Rick about behavioral health. Our behavioral health services, we have 2 staff psychiatrists and a number of psychiatric nurse practitioners who practice through our sites. And I understand where Rick's coming from. Last year we did about 30,000 behavioral health visits. So it's much needed in the community. The biggest issue I'm having with North Lake County right now is, if you read, I have had a weirdness of undocumented patients, uninsured. We can only take so many uninsured slots. And all of my resident uninsured folks are getting kind of pushed out, delayed, and it's an issue. We have gotten in, there was sort of a mandate, if you remember, through the federal government. President Trump and administration, they put a sort of a freeze on providing public benefit dollars to undocumented individuals. Well, within the government, and we are, we answer to HHS and HRSA under those folks. We're still waiting all this time for guidance, and we're sort of in a catch-22 because we're in 2 counties, and as you all know, those 2 counties, we get a lot of funding through Orange County. We get funding through the North Lake County Tax District, but very, very sort of polar opposites on the political scale, if you will. So we're dancing a dance. If we put in, without a firm mandate from the government, it would be very hard for us to put in some sort of a guardrails, if you will, because we can't have policies for our organization, you know, some for North Lake County, some for Orange County, some for South Lake County. So we're just kind of in this pattern where, you know, we've you know, sort of been, okay, first come, first serve, you know. And we're still seeing a ton of uninsured patients. I think out of the 250,000 visits for last fiscal year, we did about a little less than 30% of those are uninsured. And so when we talk about our charity care being, you know, I think it was about $13.5 million, that's absolute charity care. That's not contractual allowances or things like that, discounts from insurance. This is straight charity care. So it's, you know, it's different times right now in healthcare. So what I've asked for going forward, I'm not going to hit my budget this year. So I'm asking going forward to reduce it from $440,000 ask down to $340,000. Just because I'm, you know, still dealing with this, you know, problem of seeing a lot of uninsured patients, but trying to get the documentation. It's very difficult. We have to do it after the fact. I have a staff person that goes through every single patient in our electronic health records looking for, you know, documentation, because unfortunately we really can't ask for that right now on registration. We just, you know, and, you know, so you know, I'm sure that there are patients that we're sort of casting aside from the audit process that may be legal, maybe here legally, but if they don't have, you know, basically, you know, a valid Florida driver's license kind of thing, we're not even including them in our sampling because it's just, you know, very difficult to, you know, number one, you know, try to gather that information on the front end, and then retroactively, it's almost impossible. So, but we're going to try our best to do a better job to see if there are some, you know, some of those individuals that really do belong here. They may be, you know, visaed or green card or whatever, but right now we're just, you know, taking the easy route and saying, okay, I'm not even going to, you know, just, you know, throw them out. I mean, they still get services, but throw them out from reimbursement. So, but that's, you know, I'll open it up for anybody who has any questions about community health centers.
Thank you, Mr. Dickinson. I have a question. I'm not picking on you.
No,
I like you.
pick
So
away.
I don't have anything against you. But out of all the hundreds of thousands of patients that everybody sees that we will hear from tonight and talk to, our auditor only found 8 errors. 6 of those were yours. And 3 of them were residency, 1 was ID, 1 was Medicaid coverage, 1 was missing support. So I'm just wondering, is this a problem you're having with staff? Is this a procedure?
No, we have to, like I said, we have to retroactively go in and look through over, you know, it's between 800 and 900 records for the auditors. Okay, so part of that is, you know, Umatilla. Okay, we have to manually, retroactively go in and search every single Umatilla patient and make sure exactly that they're part of Lake County and not part of Marion County. So it's very tedious. And if I miss a couple, I mean, as an organization, I miss a couple, they throw them out, we don't get reimbursed for them. So, you know, it's just, you know, it's one of those things. I mean, you know, it's a very, very manual, tedious process that we have to go through.
Another question. You said that the local NGOs refer to you patients because you have the HRSA sliding fee. discounts, and you said that it's had the effect of pushing out uninsured patients with legal status, so you can take care of illegal or
Take care of everybody.
undocumented.
That's a government mandate right now. They have not given any guidance to HRSA about, their, no public benefit to illegals.
You
There's no
said here-
guidance, so. Yes,
you
the
said here
local
that you're
churches.
pushing
the
out.
local- Yes, organizations in the area, okay? Undocumenteds go to those people, those places, they need food, they need help, they need this, they need that. And so if they need health care, those folks send them to us. And they come, believe me, they come. So, it's not, it's just the way, it's the way the system is right now for us as a federal qualified health center. We take everybody.
So are you implying, though, that uninsured patients are being pushed out with legal status? Uninsured patients
we
with
can only-
legal status are being pushed out?
If-
Is that a choice that you guys make? That
No, if I have 500 uninsured slots, okay, that's all I can take for, say a month. I'm just throwing numbers out there, okay? The first 500 people that show up, call, make appointments, we'll take them. They happen to be, right now, it's about 50-50, maybe a little bit more on the undocumented side. It's nothing we're doing, on purpose. It's just the way, and it's gotten in North Lake County over the last couple of years, it's gotten, very, very, there's a lot of undocumented people, a lot more than I ever thought that there would be running around up here. But there's a lot. And they find us, and we take them. We have to, until somebody from the federal government that I report to tells us to stop. Our mandate is to see everybody. So,
Let's all get together and go to Washington.
yeah, I've been there every year, believe me.
Thank you.
Uh-huh.
Anyone else?
Yeah, Mr. D.
Yeah.
Not that it's, the process when they come and do the interview with your staff, is that a paper document or is it electronic?
No, usually we have a set of documents.
Paper?
That's maybe a bad word, set of forms that they have to fill out. And, then we see them. Those forms, there are some that are electronic, but these are usually paper.
Yeah, I'm just talking about the intake process. Is
Yeah.
there an electronic format that can be done better?
There is. People can go online, on the internet. They can register, they can do all their paperwork ahead of time. But we have a lot of people that come in and, get the paper forms and fill them out. We end up having to scan those into the medical record, the EHR. And that's where, when we go through our audit, now we have to go back and go through all those papers for proper documentation.
Yeah, so where I was going with that is the system able to track, is the electronic system able to track who they are, the residents, document, is there a streamlined process more than having to look at every piece of paper? There may be, but maybe you're not aware of it.
Not anything that right now I can probably legally do with my EHR.
Okay, that's what I was thinking, yeah. There may be some AI creativity out there, but more than likely there's some restraints.
Very likely is, but I may be able to use something in the future just for the purposes of auditing for North Lake County,
Yeah,
but as a general.
just a day-to-day operational, you're kind of restrained. I have no further questions.
No other questions? Thank you, Mr. Dixon. Okay, Community Medical Care Center.
Good evening. Tamara Youngren with Community Medical Care Center. It's an honor to be here on the behalf of the clinic before the board tonight. And Community Medical Care Center, CMCC, has provided medical care for the past 30 years to the most vulnerable patients and residents of Lake County and surrounding counties. Our clinic has the ability to provide indigent care visits to those in need due to our network of volunteer physicians. From our inception, CMCC has enjoyed a partnership with our local hospital, now UF Health Leesburg, who graciously provides 3 employees, a nurse practitioner, case manager, and patient financial services representative. These employees are vital to the structure of our organization. Clinic patients also benefit from our partnership with UF Health through charity approval to receive services such as labs, diagnostics, procedures, surgeries, and access for additional specialty services. These include orthopedics, physical therapy, neurology, wound care, and various types of surgeries, giving our patients great continuity of care. Currently, we enjoy a volunteer partnership with over 40 licensed primary and specialty care professionals and 25 office staff, intake, administrative, and community outreach personnel that make our clinic a one-stop medical home for patients both in primary and specialty care. This year, a community outreach committee was developed, and on April 18th, we held an on-site family fun day to draw the community in to see firsthand the clinic and learn more about our services and raise funding. These community members, along with the ministry director, have been attending events sponsored by Downtown Leesburg, Homeless Coalition, Lake Sumter State College, and other organizations, building a community network. Additionally, there are numerous community partners hosting events to help support the clinic: Harbor Hills Ladies Club, Parity Financial Group, Waterman Communities, First Presbyterian Church of Wildwood, St. James Episcopal Church, and many others. We have also contracted a grant writer who is continually searching for grant opportunities. Medical services are complemented with a state-of-the-art dental wing, where volunteer dentists, supported by volunteer hygienists and assistants, offer their time and expertise to ensure that minor dental problems don't become major medical issues. During the 10 months of the current funding cycle, CMCC has provided 1,902 patient visits and added 134 new patients. These stats have slightly increased from the previous funding cycle, which saw 1,814 patient visits during the same time frame. We project that clinics like ours will continue to encounter an increased demand for services in patients seeking care due to changes in the medical system, Medicaid, and unprecedented growth in our communities are experiencing. We are so grateful that in 1990, our community recognized the critical need for indigent care for those of our area without insurance coverage. Out of their compassion and love for neighbors, North Lake County Hospital District was formed. People who wanted to do more than talk about ideals, such as do unto others as you would do unto yourself, wanted to put them into action. Over the past 35 plus years, that compassion has assisted thousands of our residents during their time of medical need by providing access to treatment that enables individuals to heal, rebuild lives, strengthen their families, and form stronger communities. To be ready to provide a hand up to those in need of care, we plan to respectfully ask the board to allow us to continue our work by providing $155,000 in funding to meet the needs of an estimated 1,000 patient visits this coming year. It is our passion and honor to press on with our mission by ensuring that the most basic needs of the medically underserved of our community will be met by local, free, volunteer clinics in a caring, professional, personal environment, providing them and their families with health and hope for the future. Any questions?
It's not. Thank you very much.
Thank you.
All right, Lifestream Primary Care Clinic.
Good evening again. I'm still Rick Hankey, still with Livestream Behavioral Center. Change a little bit and talk about our primary care center. And this is one that I just get really excited to talk about, because about 13, 14 years ago, a study came out, and it demonstrated that people with serious mental illness died 20 years earlier than the general population. So it kind of piqued my curiosity as to why. Excuse me. And it was really the result of the lack of primary care, the primary care community not understanding the needs of those with serious mental illness, and sometimes with the psychotropic drugs interacting with other drugs, it just really made it very hard for people to get services. So it's like, well, we have got to somehow figure out how we can provide services, because we're working with the mind, but we're not working with the body. And we were making referrals to others to do that, and it was like, we can do this ourselves. So that's how we started our integrated care. Again, I've shared all this with you, but the one thing that we really felt that we had to create was a primary care home. So when individuals come in, that they could get one-stop shopping. So if they came in to see a psychiatrist, they could go down the hallway and get their primary care needs taken care of as well. So as a result, we've created that one-stop shop model that our doctors, our primary care, talk to our behavioral health care providers, so that we're providing the best treatment possible. This also allows our providers to understand what other drugs that people are on, so that there isn't any contradiction or anything like that. We also understand our population, so we made sure that our primary care providers understood our population, so there isn't any judging or anything like that. And what we found is that the primary care was great, but the other services that we provided, such as the prevention services and those types of things, transportation to our clinics, those were really making a difference. And I'll just give you an example. We have a lot of individuals that we provide care for that are overweight, and asking them to exercise it's just not going to happen. So we were able to create, using at the time the Wii game system. It had bowling and it had tennis. So we invited our individuals to come in for tournaments, and basically they got so excited because they were moving around that they said, you know what, this is a lot of fun. What else can we do? So you'll see we call ourselves the Wellness Integrated Network WIN. So we would do a lot of other things with WIN in it, like we'd have Wednesday WIN walks. So we would invite everyone to come in and we go for a walk with our staff as well as the individuals. And what we found is that they were now starting to socialize, because I don't know how much you know about schizophrenics and other individuals with SMI, but they're not really social people. And so when we got them together in a room, they started talking to each other and they became more social. And we started to see the pounds come off. We taught them how to eat. Instead of drinking 12 Mountain Dews a day, how about if we start with 1 Mountain Dew, 1 bottle of water, and just kind of go back and forth? How about if we teach you some other things, like it's okay to leave your apartment and go get your mail, and we'll do that every single day. So we really taught them life skills incorporated into the primary care. So that's really where we are today. We're very excited about some of the results that we're seeing, that people have been with our clinic for a long period of time. Unfortunately, the new people that come to us, we often are the ones that are diagnosing cancers. We're diagnosing things that, a lot of our population live with A1Cs that should have killed them. They live with high blood pressure that should have killed them, but they're resilient and they've learned how to live with that. So we're able to get them on the right medications, make sure that they're taking their psychotropic medications as well as their primary care medications. So it is a medical home. We're very excited about the fact that all these years we've been able to do that. And again, we have care management, transportation, in-home visits. We will go to their house, and we also have wellness prevention programs. Lucky to have 3 different clinics, 2 here in Lake County and 1 in Citrus County. And again, I'm not going to go through all of this, but we offer primary care. We're not the specialists. We make referrals to specialists and people who in the community that will take our population, but we are kind of that front line. So if they have a cold or whatever the case may be, we're there for them, but we also do diabetes testing, high blood pressure, EKG, things that are really in that primary care setting. Again, the benefits, it was a difficult population to treat. A lot of primary care physicians got frustrated because our population is not known to be med adherent and med compliant. So basically we do that is part of our program and teach them they need to keep using these drugs and whatever the case may be. Our population, again, not proud, but our population often overutilize emergency rooms. That's where they go. They have a sore throat, so instead of going to a primary care doctor because they don't have one, they go to the emergency rooms. And both of our, all of our hospital partners, a lot of times we're treating the same people, and we actually have individuals in their emergency rooms so that if we see what we call our familiar faces, that we can then come in, we can get that person and bring them over to our side so that they're not clogging up the emergency rooms. And a lot of times the side effects of psychotropic medications can lead to primary care issues. So we're watching that very closely. We're testing because we know what psychotropics. Again, unfortunately, our population doesn't go in and say, hey, I have diabetes, I have high blood pressure, I'm taking all these medications. They're often not very good historians, but we keep that in our electronic health record. Again, I can show you that 68% of adults with mental illness have one or more chronic physical conditions. People die earlier, as I shared with you, and more than 1 in 5 adults with mental illness have a co-occurring substance use disorder. And the solution is integrated care. When we have them come in and they can go right down the hall and see a primary care provider, they're more apt to see and continue with their primary care services. Again, these are awesome statistics, but integrated care reduces costs and improves care. 35% reduction in inpatient costs. We don't see people going into our hospital because we can actually catch them. If they're coming in for the primary care and their psychiatric care, we can catch them before they get into crisis. So we have seen a decrease. A 39% in ER costs. They're not using the ER, they're coming to us, and we're treating them for their primary care instead of going to the emergency room. And a 26% in total medical costs. So if we can catch it earlier, and I will share with you, and it's unfortunate, but when we first opened our WIN clinic, we had people, as I said earlier, coming to us that were severely sick. They had cancers. They learned how to survive and how to live with this, and we were able to diagnose and get them the right treatment. So we're seeing a decrease. We're also seeing a lot of decrease or increase in health outcomes. Things like the consumers that are their high blood pressure, their diabetes, they're more med compliant. So we're really excited. They're losing weight. And they're not using Ozempic. We're not Ozempic providers, or any of those. So, but we're teaching them good life skill habits so they can have a good life. We've been able to provide this year so far services to over 4,000 individuals in our WIN clinic. They are integrated in our system, so they're pretty much the same individuals that we're providing psychiatric care. And you can see from some of these things, we've been able to reduce cholesterol. We've been able to do some things, again, with these fun type of prevention activities. We know that integration works. Thanks to you and the money that we get from the North Lake Hospital Taxing District, it allows us to continue to provide these services to our very vulnerable population. So thank you. We really appreciate it. Our request this year is the same that it was last year, $100,000. We are able to stretch that in a lot of different ways, but it really does help, and it allows us to do what we do. So thank you all very much. Any questions?
You talked about same-day service at your hospital. How has that worked as far as the WIN clinic goes? Are they able to get faster service there?
As part of that initial coming to us and getting that assessment right away. In the past, they would make a phone call. We would put them to our most expensive service. We'd say, well, you need to see a psychiatrist. And that's almost like I wake up with a sore throat and they say, I'm going to make an appointment with a surgeon. Doesn't make sense. So now with same-day walk-in services, we're able to do a triage. We're able to do the assessment. And Elise, who's sitting over at our chief business officer, has really integrated in that assessment. Ask them if they have a primary care provider. And if they say yes, have you seen that primary care provider in the last 3 years? no, then we're going to get you involved in our primary care services. So that's how we've been able to increase the numbers and get more involvement, because our population isn't going to do it on their own, but if we can make it easier for them. So if they come in, we get them the outpatient therapy or case management or whatever they're needing at that moment. We also, now we can't force anybody, but we also encourage them to get the primary care services. And that has been very successful.
Thank you.
All right, thank you very much.
Thank you. I may have overlooked Advent Waterman Community Primary Health Center. Sorry about that.
Our new CEO presented on our behalf. So that is why you have not seen me, but hello everyone and thank you. And I appreciate your opportunity to listen to our CEO, Brandon Nudd's presentation on our behalf.
Okay, thank you. Appreciate it. Okay, St. Luke's Medical Clinic.
Good evening. I'm Erin Burley, the Director of Clinics for Catholic Charities of Central Florida, and I'm here representing St. Luke's. First of all, I'd like to thank you for your previous support of our clinic. And I wanted to start tonight with a story about a patient just to give you an idea of the work that our clinic does. David, who was 24 years old, walked into our clinic frightened and confused, thinking that his life was falling apart and he wasn't sure why. His hands were shaking and he was losing balance without warning. Simple tasks, the kind that most 24-year-olds don't think twice about, were becoming a struggle for him. He was seen by one of our primary care physicians who ordered comprehensive labs and coordinated testing. Upon reviewing the results, she then referred him to our volunteer neurologist. The neurologist diagnosed him with Parkinson's disease, and he began a course of treatment. His symptoms began to subside, and he now has a full-time job, and he has health insurance. For 16 years, St. Luke's has been the safety net for people just like David here in North Lake County. We provide primary care, podiatry, and neurology, as well as dental care. Last fiscal year alone, we provided 383 medical visits and 546 dental visits. When a patient like David comes to us instead of the emergency room, the system saves hundreds, if not thousands of dollars on a single visit. Your financial support helps us prevent those costly ER visits, keeps chronic conditions managed, and keeps working families healthy and in the workforce. We provide evening clinic hours so our patients do not have to miss work. We keep our costs at a minimum by relying on volunteer medical and dental providers as well as volunteer administrative help. The funding that we receive from the hospital district is only a portion of what we need to keep our doors open. We also receive support from the local Catholic parishes, private donations, support from the diocese, and are constantly applying for different grants. I would ask that you thoughtfully and prayerfully consider our request for funding. Any questions? Okay.
Okay, thank you
Thank
very
you.
much. All right, are there any other clinics that would like to present tonight? Any? Okay. All right, at this time, I'll ask for any public comment. Anybody have anything you'd like to say to this board? Any public comment? Okay. And how about the board? Any comments anybody wants to make or questions or anything? Wow. All right. Everybody on this end happy?
I'd just like to remind the board, the next meeting is July 16th. I believe everyone said that they would be there, and hopefully they will be. It's my understanding that Ms. Price will not be able to attend the September 24th meeting, but hopefully everybody will be here July 16th and September 10th and the 24th. So if you're having problems with those dates, please let us know right away, because with the budget, we have to meet the trim criteria for dates, and it's real important that we work around the facility also. So, thank you very much.
Okay, thank you, Ms. Kirsty. All right.
We had July
16th.
July 16th, I think it's on your agenda.
Okay, I've already put it in there.
All right, nothing else? Good evening.